Do you use a drain or do you not use a drain during your tummy tucks? Hi, I'm Dr. Dallas, and there's a lot of questions I get when people come in for, let's say, a mommy makeover or a tummy tuck. Well, I typically use a drain, and the reason why people use drain is because there's a lot of fluid that it can accumulate underneath the skin that we lift when we do a tummy tuck. And that's to decrease the chance of, let's say, a seroma or a fluid collection occurring underneath the skin. Because if you get a seroma, yes, it's not the end of the world, but you end up having to drain it perhaps with a needle outside in the office or after surgery. But if you have a drain in place, all that fluid's coming off during the post-operative period, and then usually after a week, we're able to remove the drain and the body's able to handle that extra amount of fluid. We like to use drains because I do a lot of liposuction. So in addition to doing a tummy tuck, we're also putting a lot of tumescent fluid inside the body so we don't have a lot of oozing or bleeding during liposuction. And so because I put a lot of tumescent in, a lot of that has to come out in the first 2, 3, 4 days. And so I find it extremely important. I rarely get seromas because I use that drain. Now, there are people who don't use drains, and that's certainly okay too. They do other sorts of things to try to prevent seromas, but I think that they're probably not doing as much or extensive liposuction and putting in all that tumescent fluid for the liposuction. So the results that I'm giving is really going to be the most aggressive when it comes to body contouring. Really nice waistline, adding some of those lines, athletic abdominal lines with the liposuction. And of course, you're going to get some fluid that comes out because we're doing all these sort of high definition liposuction techniques during our tummy tuck. And so that's why I like to use drains. Don't rarely see a seroma. And like I said, we remove that drain usually at a week. And people who don't use drains, that's certainly okay too. As long as they're not getting seromas, that's fine. But I typically see they're not doing as extensive definition or high def liposuction along with their tummy tucks.